Morning, everyone, and welcome to our February 2nd, 2026, which I should maybe fall back to, which was our January 26th meeting that was pushed off. I think we were being cautious. I don't think we got the accumulation that was expected, but at the same time, putting people on the roads when not needed, I think we had a consensus on today, and so welcome to our council meeting. So, Madam Clerk, if you can call this meeting to order.
It's moved by Councillor Broad, seconded by Councillor St. Pierre, that the meeting of the Council of the United Counties of Stormont, Dundas and Glengarry be hereby called to order.
Thank you. All in favor? Motion is carried. Moving on to the adoption of the agenda.
It's moved by Councillor Densham, seconded by Councillor Broad, that Council approve the agenda.
Thank you. Any comments, omission on the agenda? Seeing none, all in favor? Motion is carried. Is there any disclosure of pecuniary interest, nature thereof? Seeing none. Moving on to the adoption of our minutes.
It's moved by Councillor St. Pierre, seconded by Councillor Fraser, that the minutes of the meetings, including the in-camera minutes of the Council of the United Counties of Stormont, Dundas and Glengarry, held December 12th and December 15th, 2025, be adopted as circulated.
Thank you. Any questions, comments? Seeing none, all in favor? Motion is carried. Moving on to our delegation. First one, I'd like to welcome Mr. Shawley Boland to come and meet with us. He's the Chief Executive Officer of the Winchester District Memorial Hospital, as well as the Dundas Manor Long-Term Care Home. Welcome, Shawley.
Thank you very much, and thank you for the opportunity to speak with you today. I'm really here today just to give you updates, and ostensibly about the hospital, but because you're such an important partner, I wanted to start off with an update about Dundas Manor. And most, if not all of you, are pretty familiar with Dundas Manor. It's located in Winchester, right next to the hospital. And some of you will know, those of you who've been on a tour, that for about 10 years we lamented that we needed a new building. There's absolutely no space in Dundas Manor for what we do there. The building is in poor repair. So that took quite a while with some help of council and the local council to advocate for that. And finally we got approval, and about 2 years ago, several of you were able to join us on an empty field where we were able to turn the sod and begin the project of constructing a new Dundas Manor. So that was 2 years ago. This is a very recent picture of it. We are now about 80% complete. We are on track to move in and depart from the current building sometime in early fall. And it's gone very, very well. Believe it or not, we're on budget, we're on schedule, and things are just progressing quite well. And that's exactly what it looks like. This is what it will look like, hopefully in the fall, when we actually are completing. So that was just a quick update. As I said, everything's going well, but what I really want to do today is just thank you. We are this far. We got approval, and we are this far with a very important partner, and that's all of you. SDG Council, you've supported us financially, you've supported us in many other ways, and I really want to single out someone whose time here is winding down, and that's Maureen. Thank you very much. When Maureen came on board, the support from you folks from this organization ratcheted up. Financially, incessant questions from us and our bankers, getting signatures, managing bylaws, that kind of thing. And literally, we couldn't have done it without you. So thank you to Council, and thank you very much, Maureen. So moving on to the hospital, we're going through a strategic planning process, and we haven't completed it yet, but I've spoken with many of you to get your perspectives and your awareness of the hospital, and I was reminded that prior to the pandemic, I actually came around to different councils every once in a while and gave you updates, and we haven't done that in quite a while, and there's a real gap in information. So we're reestablishing that and actually starting today. So I want to give you an update on Winchester District Memorial Hospital. At the hospital, everything starts with our commitment. That's our version of our mission, vision, and values. It's a commitment to our patients, our community, to our hospital, to each other, for everyone who works at the hospital. And, it reads like a typical mission statement, but it's summed up by the two words, compassionate excellence. We strive to do things better and better every day, but with our heart leading the way in support of that. So everything is compassionate excellence. In terms of excellence, there are a lot of things we can brag about, and we do brag about them. We do very, very well in patient satisfaction. Every hospital in Ontario has a separate organization who at arm's length surveys patients and monitors satisfaction. We are one among the highest in Ontario. We do really well. That said, I don't want to say we're 95% or that close to perfect. We can always improve. We do make mistakes. We do get some complaints, a very small number, but we're always trying to do well, and we're very proud of that. We see over 80,000 patient visits every year. The majority of those patients live in SDG, and that continues to grow year by year. We, every 4 years, us and just about every other hospital, subjects themselves to accreditation, where a national body comes through and measures us against a whole bunch of criteria, predominantly patient care, patient safety. Every year, every time they come through, we get their highest award, exemplary award, and the most recent one was just last November, so we're very proud of that. We monitor quality in a lot of different ways, and basically if something's supposed to be high, we usually do it high, and if something's supposed to be low, like complications, that kind of thing, it's pretty low. We have a very strong infectious outbreak infectious protection program. Of the 145 hospitals in Ontario, we may be the only one that's never had an internal transmission of COVID, and probably 10 or 11 years since we've had internal transmission of anything. So when you come to the hospital, just as accreditation is confirmed, you're very, very safe. You're not going to leave with an infection you didn't come in with. We are a satellite program of the Ottawa Regional Cancer Program. Small hospitals like us are satellites of larger programs. We happen to be the largest satellite of any type in Ontario, which means, unfortunately, for those who have a cancer diagnosis, we get a lot of practice. And the standard of care you would get at Winchester getting treated for cancer would be the same as anywhere else. And in addition to the large accreditation we get for the whole hospital, individual programs get accredited, such as pharmacy and lab, just about every year. So this slide kind of sums up, although we think we do a really good job, it's great when an external party comes along and confirms that we are doing a good job. In terms of what we do, you're probably familiar with our major programs: surgery, maternity, cancer care, kidney dialysis, inpatient services, outpatient services. We continue to add according to community need and what we know we can improve on. Lots of outpatient services. We've had new services. Dr. Paul can remind us that in our area, unfortunately, there's a higher average rate of smoking than in many other areas. So since the pandemic, we've added some respiratory services, pulmonary function testing, which tests the strength and the health of the lungs and by extension the heart, respiratory therapy to serve people who've got COPD, other respiratory diseases, and most recently the Ontario Lung Screening Program, where if a doctor suspects someone of having potentially lung disease or specifically cancer, they will refer them to us, and we'll do a complete workup under the auspices of a provincial program. We've added medical specialties, addressing skin, neurology, issues of the brain, nephrology is the kidneys, and then we've had an ophthalmology program that was very high profile and very well used, and it was dormant for a couple of years because our 3 ophthalmologists, 2 retired and 1 left, and we had a hard time recruiting. So ophthalmology is actually back up and operating as of last week in Winchester, so we're very thrilled about that. We have 1 ophthalmologist who's working and 2 more kind of in the wings who are thinking of establishing a practice. So that's good news for the community. We teach and do research. We have a family medicine residency program, so you may be familiar with this. When a doctor finishes their 4 years of university or medical school, they have to do 2 more years of what's called a residency, which is kind of on-the-job training under supervision. We started that back in 2012, where we had 2 residents. And today we have 9, or actually 10, I think this is outdated. Every year about 4 spots come open, and we have 250 applicants from across Canada applying for those 4 spots. It's a reflection of the quality of the teaching we provide and the breadth of services we have, and it's one of the most high-demand family residency programs in Canada, literally. We also have other students, 250 trainees, we have medical students, we have nursing students, we have pharmacy students, physiotherapy students, even health administration students. And they really add to the hospital. It's great to have new blood, new ideas come in. It helps us pursue excellence. And if you're a preceptor like I am, it really keeps you on your toes. So it's a really important part of our hospital. We also do research. And if your idea of research is kind of someone walking around with a lab coat on, filling out a clipboard, and then it goes on a shelf somewhere, that's not our idea of research. We began with research on clinical studies. For example, what's it like to be discharged from a rural hospital? What's it like if you come into our ER and find out, or have some mental health challenges? And we raise those questions, and we do a study, and if we're doing well, we publish and tell the world, and if we're not doing well, we try and figure out how to improve, and then we publish and tell the world. And then recently, we've gone to doing clinical trials. That's where we work with a drug company and do, I guess the official term is experimental drugs, but they're emerging drugs. There's three stages of bringing a drug to market. The first is testing to see if it causes any harm, and we're not there. That's phase 1. The second phase is to determine, is it really doing what it's supposed to do? And the third phase is what's the actual dosage, and how can we best set up the patient for success? We're in these stage 3 trials with all kinds of medical conditions, heart disease, lung disease, of course, asthma, obesity. And the real value, it's great for us to be doing that research, but it really provides the opportunity for people in our service area, in our catchment area, to have access to these drugs who are safe by the time they get to phase 3, and give them an opportunity to take advantage of those drugs, which they wouldn't normally be able to do. They'd have to wait for years for it to come to market. We also lead a health hub, or whatever term you want to use it. Health hub was the term the previous government used, and so we used it. On the site in Winchester, we have ourselves, the hospital, we have Dundas Manor, we have 2 other buildings. And for the Winchester and pretty much North Dundas area, almost any and every community or mental health, social, and healthcare services are on that site. We're not, the hospital doesn't control it all. We're landlords for a lot of them, but we share things. We share referral patterns, we share education, we share some social events and photo opportunities, and so we have everything from home care, public health unit, mental health. We also have a data center in the hospital that serves hospitals all across Ottawa and the Champlain area. For example, all the laboratory data in any hospital in Eastern Ontario resides where we are. We have 2 important applications that all physicians use, e-consult and e-referral. The bits and bytes of that resides in Winchester's data center. So what does that mean? Well, we actually get funding for those particular IT initiatives, which allows us to provide better support for all the computers in the hospital. And as you can imagine, just about everything is hooked up to a computer. One of the trickiest questions I get is how many people work at the hospital? Well, we have a little over 400 who are officially on the payroll. We have over 200 doctors, dentists, and midwives. Now, that's mainly doctors. We have 1 dentist and 8 midwives. We have volunteers, always looking for more volunteers. We actually had about 200 before the pandemic, and unfortunately, many chose not to come back. So if you know of anyone who would like to volunteer at the hospital for an hour a week or a couple hours a month, let them know. We'd be happy to talk to them. And then, of course, trainees, students, and the like. We're very, very proud. We are fully staffed and have been for several years. WDMH is seen as a desirable place to work. Your economic development folks have prepared an excellent video that we very much appreciate. We've never had to use a staffing agency, and we continue to be fully staffed. You know, we have turnover, but we can fill those jobs just as soon as they come open, so we're very proud of that. We're also very accountable. We balanced our budget for 15 years. The last 3 or 4, we've actually been in deficit, but just before Christmas, the government provided funding assistance to pretty much all the smaller hospitals in Ontario. So it looks like our financial woes may be a thing of the past. We have very few alternate level of care patients. Alternate level of care, ALC, those are patients who come into the hospital, get treated for whatever they came in for, but have no place to go. There's no place stable. Often they have to go to a long-term care home. We have worked very closely with our community partners because a hospital is a terrible place to be if you don't really need to be there. So we have very few of those patients, and we always find a safe place for them in the community rather than being in the hospital. We have a very small administration. According to the Canadian Institute of Health Administration or Health Information, of the 65 small hospitals in Ontario, we have the smallest administration. Now, if you're in administration, being the smallest isn't necessarily something you're thrilled about, but it means we put more money proportionally into patient care than other hospitals do. Government sets out targets, efficiency targets that we're supposed to meet. We meet by a long shot many of them, or exceed many of them by a long shot, meet several other ones, so we're doing well from that perspective, and that again means a dollar spent at WDMH goes a lot longer to, meets a lot more for patient care than it does in many other hospitals. Part and parcel with us being a desirable place to work, we have very low overtime and low sick time, and as I mentioned, we've never used a staffing agency. So we've got everyone who works there is an employee of WDMH. And just coming to a conclusion, what are some of our challenges? Well, I've got finances here because we're not completely out of the woods, but it seems like the government is providing stability to small hospitals like us. As much as we are fully staffed, we have had quite a bit of a turnover in the last several years. So we've got new young staff, which bodes well for the long term of the hospital, but they're just not as experienced as the staff that have retired. So that's there's a training period that comes along, and that's something we have to support. Technology acquisition is something that's always a difficulty for smaller organizations. There's just a certain amount of money you have to spend on a minimum state of technology. We are pretty much pretty technology advanced, but it's very, very expensive. Our foundation does yeoman work in terms of raising money each year. We're really getting into artificial intelligence, and we're in partnership with many other hospitals, but that obviously has a high price tag, but we continue to pursue that. Cybersecurity is always a challenge, and I'm imagining with any organization. And then our ER wait times, we're no better or worse than other hospitals. Most people who I've talked to, some of you, and people in the community, if they know anything about or have anything negative to say about WDMH, it's about ER wait times. So some of you may know, if you come to the hospital with chest pains, we'll see you in a matter of seconds. If it's something less serious, you may wait quite a bit depending on the day and what's ahead of you. It's not first come, first served. And our next big project, we've been advocating for 2 years now to bring in an MRI to Winchester. We have the space for it. It's one of the top, it's actually the top demand when we do a patient survey, and we've done a recent survey for strategic planning. It was the #1 service people requested. Obviously, it's a challenge to have to go into Ottawa or leave the community to access an MRI. If you're an inpatient, you have to get into an ambulance and there's a delay. So we're just awaiting, we're working with our MPP, and we're just awaiting, hopefully, government approval sometime in the foreseeable future. So once again, thank you to the county and council for your great support of both the Dundas Manor and the hospital, and it's a pleasure to speak with you today. I'd be happy to answer any questions.
Perfect. Thank you very much, Shali. So I'll take questions from the floor, starting with Councillor Densham, and I'll follow up with Councillor Broad.
Thank you, Mr. Warden, and thank you, Charlie, for being here. My time on the board was, the hospital board was during the pandemic, and so you really saw what a strong foundation WDMH had built before that. The incredible pressure that were on the people and were on the finances at that time. I don't think a hospital could survive if it didn't have a strong foundation coming before that. So congratulations for that. I'm glad to hear that you're getting a better provincial support in terms of finances. Maybe you can give us a hint into how we can make that happen on our side. But truly, the compassionate excellence is their top priority. I saw it firsthand. And every employee that I saw was focused on putting the patient first, and I congratulate you for that. And also the great partnership you have with Dundas Manor as well. I think it's incredible how a partnership like that helps both parties. And so again, I saw that firsthand, and so just thank you for all that you do, and thank you to the staff.
Pleasure. Thank you.
Councillor Broad.
Yeah, thank you, Warden, through you, and thank you, Charlie, for coming today. Councillor McDonald and I were on a call in the fall with North Glengarry Hospital, and we found it very intriguing, the information we can have, and I'm glad to have you return and give us updates, because I think it's really important as we're in the community, we understand the stats and the demographics of what's happening at our hospital, because people do want to talk about it, especially wait times. That being said, obviously fundraising can be fatigue in the communities, and I know we're continuing to fundraise for the Dundas Manor with our upcoming Snowflakes and Sapphires event in February. Question for you, Charlie. MRI machine, typically equipment purchases or fundraise through the community. Are you going to be looking for the community to help fundraise for that MRI machine?
Yes, we will. Hopefully it'll come soon, but towards the end of our needs for Dundas Manor. But likely around $6 million will be required both for the machine and renovations.
Any further questions? Go ahead, Councillor Fraser.
Good morning, Charlie, and thank you for being here and presenting that. It was quite a fulsome presentation and lots of good information. But you mentioned the government approval for the MRI, and just to piggyback to Councillor Broad's thought, can you just expand on what the government approval entails?
Well, there's kind of two things. There's our wish list and the minimum required. So the minimum required is we are not allowed by law to purchase an MRI unless the government approves it and gives us certification. So we need that as a minimum. And we're ready to go forward with just that. That said, it costs about $800,000 a year to operate an MRI. And most small hospitals, when they get approved for MRI, get government funding to the tune of that magnitude. So that would be our wish list, that we not only get approval, that we get funding for that. But this is so important, we'll find a way forward, even if we don't get that operating funding.
Thank you. And if I may, Warden, one other thing. I was just talking earlier before the meeting started with my fellow councillor Gaindo about Flash Dash and Movember and some of the things. Could you please tell us a bit about the PSA clinic and the success that's had at WDMH with the PSA clinics during that time of year?
So in Winchester, North Dundas, or maybe it's all Dundas County, we have a very energetic group of gentlemen who are prostate cancer survivors. And they came up with the idea and a lot of the energy to annually have a clinic, because you may be aware, to get a PSA test, which is a key test for prostate cancer, the potential of prostate cancer, you actually have to pay out of pocket in Ontario. So starting in 2015, by the energy of this group and the work of the hospital, and on a Saturday in the fall, we hold a clinic where a urologist comes and gives education and provides information, and we have a whole bunch of hospital staff who volunteer to register these men and take their blood samples and send them in to get tested for PSA. So it's I can't remember the numbers from the early years, but recently we have between 200 and 300 men who come from all over Eastern Ontario to get this information, to get this test. And every year we find about 10 to 15% of them have a positive PSA test, which means there's the potential that they may have cancer or develop cancer. So it's been very, very successful. It's not just the hospital and this group. There's other groups that come in, Ride for Dad, the motorcycle charitable group, Prostate Cancer Ontario, which is another group, a support group. So it's been a team effort and a very successful initiative.
Thank you, and thank you, Mr. Ward.
Thank you. Any further last questions? Seeing none, so I have one of my own. In regards to Dundas Manor, so the additional beds that are going to be opening up in the fall, are they already spoken for with that long list of, and is there an opportunity for, because I know often if you're maxed out, you get local residents needing the facility, they get to be put elsewhere in the time being. Is it something where we can get more of the local aspect to utilize those beds?
So two parts to that question. We, Dundas Manor, the hospital, has no control over placement in long-term care. That's done by the home care, the government home care folks. And so it's based solely on need, not by geography. And the thing about that is if you've got kids, for example, in Winchester and mom is on her own in Toronto, she gets just as good a chance as getting into Dundas Manor as someone local if there's a medical need for that. So that's the process. In terms of when, we will have, it turns out now, about 50 more beds than we're using right now, or 55. We can't really confirm new residents until a couple of weeks before we move, because just people change. There is a list. There's a list for Dundas Manor and a list for Eastern Ontario, but the process is, because it's based on need. Needs can change in those last couple of weeks. So if you're on a list somewhere to go into a long-term care home, you probably get a couple days notice, and you just get a phone call.
Perfect, thank you. And one last thing, so if my wife calls for me, make sure you
So
give me a
noted.
call. So one last thing, that's something I'm very proud of. So, we had the discussion in the fall when you reached out to most of our local municipalities. We had a clinic that came to Berwick. They used our parking lot facility in regards to a melanoma mobile mole screening clinic. And I got the numbers that were sent to me after the day. They seen 123 people that day. 27 were detected to have some form of cancers in that. But I mean, to do that through a hospital, you're going in there to meet with your local doctor. Then you're getting pushed to a specialist, and to be able to see 123 people in that form through a hospital, I think there is great value in this mobile clinic. I went there thinking, I'll go and get you. The lineup was to the road by the time I got there, 15 minutes in. So anyways, something we discussed, but
Yeah.
To look forward, I think it was something that was very beneficial, and a lot of chatter on social media in regards to that event. So maybe just
Sure thing. We'll
something
look
to
into
keep
it,
in the back of
yeah.
your mind under the discussions that we had. So thank you very much, Shali. And from there, we'll move on to our second delegation. Looking in regards to our 2025 biennial bridge inspections, I'd like to welcome Tashi Dwavetti and Nicholas Brown from HP Engineering. Welcome, gentlemen. got that?
If I could just, yeah, sorry guys. So good morning, County Council, and Happy New Year to everyone. Just want to do a quick introduction before we got going. Today we have HP Engineering here to provide an update to Council on our 2025 Regional OSIM assignment and the health of the network. The term OSIM refers to the Ontario Structure Inspection Manual, which is a mandatory detailed visual inspection to determine a structure's condition, provided a rating, and any required work. These inspections must be completed every 2 years. Some of you may have seen Tashi Davidi and Nicholas Brown around your council tables in recent weeks as they have been working their way through the region. Early last year, we embarked on an assignment to perform OSIM inspections on over 400 structures across 7 municipal partners. HP Engineering is not unfamiliar to SDG. Tashi and Nick have been a part of design on several projects during this council's term and beyond. In recent memory, HP has provided design services for Lunenburg, Grady's, Oak Valley, and Martintown Bridge, along with assignments for other local partners. This assignment is one of the larger in the area and certainly takes a significant level of effort to complete both the fieldwork and reporting. Staff very much use this as a tool to try and plan ahead for our upcoming budgets and integrate into the asset management plan. You may remember that when Council awarded this assignment, we did speak of trying to cast a wider lens across the region and look for bundling opportunities between municipalities to try and stretch out our dollars. HP did break down those borders and draft a map of what the joint needs look like with a filtered year of work so we can all discuss opportunities as they arise and see if it works for everyone. I don't want to steal too much of Tashi and Nick's material, so I will pass it over to them for their presentation and available for any questions if needed.
All right. Thanks, Matt. Good morning, everyone. I appreciate everyone having us here to give this presentation. My name's Tashi Davidi. I'm a senior structural engineer at HP Engineering, and this is my colleague Nicholas Brown, also structural engineer at HP Engineering. So we're giving a little presentation today, just a State of the Union with regards to the bridge inspections for Stormont Dundas this morning. So I'm going to turn it over to Nick. He's going to do a little introduction on the inspections, and then I'll take over from him.
Excuse me, good morning. So as Matt said, we were responsible for carrying out the OSIM inspections this year. So the provincial government mandates the inspection of all bridges and culverts with a span greater than 3 meters every 2 years. I've completed a few thousand of these inspections in the past, and Tashi probably an order of magnitude more. For the United Counties, a total of 184 structures were inspected. That was, I think we have some older numbers there. There was actually 71 bridges and 113 culverts. Generally, for these inspections, it would be 2 inspectors from HP, more often than not myself and a junior inspector, would visit each site. We would walk around with chest waders, so it's a visual inspection, so every component that we could visually see with chest waders being the only specialized access. And we would document the condition of each element, noting the type and quantity of the deficiencies. Supplemental to these, we may also recommend an additional investigation. Perhaps if the access is limited, we'd recommend underwater or drone inspection, or if there is particularly advanced deficiencies or concerning deficiencies, we'd recommend a more detailed condition survey or structural analysis. Based on the findings of the field report, we would then recommend renewal options if necessary. That would be a major or minor rehabilitation or replacement for structures with particularly advanced deterioration. And these would be supported with a preliminary cost estimate.
Okay, so this first slide we have up here, this is just a summary of all the bridges and culverts that we inspected and a summary of the major recommended work. So this list here, replacement, major rehabilitation, minor rehabilitation, additional investigations, this is roughly over the next 10-year period. So as you can see here, we have 28 total structures for replacement, the bulk being culvert, about 20 for major rehab. And we define major rehabilitation somewhere when the cost of the rehabilitation is somewhere around 60% of the replacement cost. That one is bulk of them are bridges. Minor rehabilitation, 27, and minor rehabilitation is typically defined of rehabilitation that's around 25% of the replacement cost. And then additional investigations, as Nick pointed out, that would be a deck survey or a structural evaluation or a rehabilitation study. So these are just the numbers that we've come up based on the latest round of OSIMs. On the side here, we get a total estimated asset value. So this is a number developed. So for each bridge and culvert, we have a way to calculate roughly the replacement value. It's essentially based on $1 per square meter. It's a sort of a Ministry of Transportation standard. We sort of filter in our costs. I probably have, I don't know, 20 plus years of data indexed over the years for various types of structures for rehabilitations, replacements. So we generate a rough value, and then we apply it to each structure. It's not a perfect, because depending on the individual structure, you could have unique, poor foundation conditions we wouldn't know about. But this is a good rough guide. So for the Stormont Dundas inventory, the total is around $318 million. That's total asset value I guess it'd be $20-25. So, right, Nick, if you flip to the next one. So this next slide here, this is just more to provide a bit of a visual or spatial representation of the recommendations that we're providing from the reports. So we've sort of color-coded it. This is just to give an idea. So the red is structures, bridges, and culverts. I think the culverts are the circular ones, and the bridges are the squares. But anything in red, this is the 1 to 5. So this would be the structures we recommend doing some form of work, either replacement, major or minor rehabilitation in the next 5 years. And the blue is the similar for the 6 to 10. So it just gives, this gives just a spatial representation. I don't know, we may have a bulk of structures in the west and maybe the southeast, but this is just sort of to highlight roughly where. So this could be used for, I guess, for future planning. If you're closing one bridge and you defer the rehab on an adjacent structure to the following year. So this just gives an idea. So it can be sort of down the road when we're starting to plan out these structures. So next slide, bridge condition index. So as Nick pointed out, when we do the inspections, we break the structures down and we rate elements. So for example, a culvert, we might split the culvert into 6 or 7 elements, a bridge, 10, 15, depending on the size of the bridge. And then each element gets rated percentage good, fair, excellent, good, fair, and poor. And then from there, the Ministry of Transportation has a calculation that we just put on. We have a spreadsheet sort of set up that it's a weighted average. So structure elements that are more important get a higher weighting in the global ranking. So barrier or deck gets a higher rating than, say, substructure elements like an abutment or foundations and that sort of thing. So from there, we basically generate a number out of 100 for each structure. So and then it gives you an idea of the general condition of the inventory. So for example, excellent is 80 to 100. We have about 20 structures. Good, the bulk of them are in good, 110. Fair, 60 to 70, and poor, less than 60. So you can see here the average is 71, which is good. And if you actually look at, I think we did a quick comparison of these numbers compared to the previous OSIM. And these numbers show an upward trend even from the 2 years ago. Notably, I guess the structures in fair and poor have decreased, and the ones in excellent have increased. Actually, they increased quite a bit. I think we had about 250%. So this is good. This means that structures are being dealt with, replaced, rehabilitated. So that's a good trend to have. So this next slide here, this is just an estimated remaining service life. So again, when we do these inspections, when you build a new structure, typically a bridge, it's assigned, we design it for roughly a 75-year design life, as well as a concrete culvert. Steel culverts will typically assign maybe around 50 years. Now these numbers can vary. It may depend on the environment they're in, how well the structures are upkept with regular maintenance and that sort of thing, and if they're rehabilitated on time. But on average, we take the data we have from the original construction date and the rehabilitation history, as well as what they actually did to rehabilitation, and we just develop a list of estimated remaining service life. So as you can see here, we have, in terms of the snapshot, we have a number of structures less than 10 years, then 10 to 20, 20 to 30. So on average, I guess the remaining service life here for the county's inventory is around 26 years. And I think in terms of, if I compare, I think we compared this as well to the 2023 inspection with remaining service life. And again, there's a trend toward the longer term categories, which is good. That means that structures are being rehabilitated and the process is working. So I think the next slide is forecast capital expenditure. So this is, again, a summary. Some of you have seen this presentation we've done. We've come up with a 10-year plan. So we take all the structures and sort of provide a recommendation of dollars per year in terms of rehabilitation work and associated costs. So it just gives you an idea of the kind of numbers that we're looking at in terms to spend to maintain the inventory and to keep those trends moving upwards. So in this case, we're around about $6.2 million a year for recommended works between the bridges and culverts. So this would be rehabilitations, replacements, and then about $770,000 for associated costs. So associated costs would be the associated rehabilitation studies, evaluations, and there's also we factor in about roughly 10% of the rehab costs we sort of put as design work. So you might have some geotechnical work, environmental, the actual detailed design. And then, so this is just sort of gives a good picture of what we're proposing over the next 10 years. So, and I think this aligns. I believe this is very similar to the previous in terms of cost per year. So, and then the next few slides. These next few slides, just is a couple of samples of bridges that are upcoming for rehabilitation. This is Black Creek Bridge. Currently, we're in the planning stages, I think, with the intent to rehabilitate. This structure will likely be a rehabilitation over replacement, and I believe it's slated for either 2026 or 2027, depending on budget. So it's in kind of the design or the preliminary and design stage right now. Another structure we don't have on the picture for bridge is Dixon's Creek. That's another structure we're working on now, and it's a similar. We're in a similar stage in the design stages now with a potential 26 or 27 construction. The next one we have is, this is an example of one of the culverts in poor condition. You can see here with the fairly heavy deterioration below the water line. This is not untypical for these type of culverts. And this one, I believe, is also slated for, this one would probably be a replacement. I think we have it recommended. And I think it's in planning now for possibly 26 or 27 replacement. I think move on to the next few slides. So we had a discussion with Matt about possibly coming up with kind of a global map. So this we put together, since we've done all the municipalities. So this has all the municipalities in Stormont Dundas except for North Stormont. Now we probably could have put on, we did North Stormont's OSIMs, they just weren't part of this combined package. We probably could have put them on. But this just gives an idea of, we took all the culverts for recommended work, rehabilitation, replacement over the next 1 to 3 years. We sort of brought the time frame down a little more because there was too many structures if we did it to 1 to 10. This just gives an idea of across the entire county, including townships, the structures that are recommended for work in the next 3 years. It's more, again, something possibly used as a planning tool. I know especially for culverts, what we've done in the past, especially with the counties, is you do, there's an opportunity maybe to combine structures together that are bulked in the same area and maybe do a supply contract, and then might get some better pricing as opposed to a whole bunch of independent structures. And also we could use the map to look and plan out when certain structures get done across the counties and townships, so we're not closing roads. When you're replacing a structure and you put a detour, well, you don't want to have that structure being closed as well. So this is just sort of a map we came up with, and I think we have a similar map, the next one for bridges, again for the next 3 years across all municipalities except for, again, North Stormont. This one, the map's a bit smaller. Bridges, we've had some discussion. This would probably be more used for planning in terms of road closures. Typically, we find with bridges, if you have a major rehabilitation, I don't think there's a huge advantage of trying to bundle bridges together. That doesn't tend to necessarily get you a huge savings, but culverts for sure. So that's just a map, kind of a summary, and I think that's pretty much I had for presentation. So I'll open up the floor if anyone has any questions. We can hopefully answer.
Thank you very much, Nicholas. I'll take questions if there are any from the floor. Go ahead, Councillor McGillis.
Thank you. Thank you for your report. We spend a lot of money in different municipalities. I think they're caught up with their asset management plan. I was just wondering, how well does this align with the asset management requirements here for the counties, all of the survey that you've done here today?
Maybe Matt can jump in. I think he probably knows a little more on their actual plans, where we just deal with mainly just the bridges and culverts.
Sorry, could you just repeat the question? I didn't quite hear the end of it.
Wondering how well this aligned with our asset management plan that we have in place here at the counties, with all the things that, requirements that are needed for updating the bridges and culverts for repair and maintenance.
So we did have an update just before this report. So I've been working with Sarah and Rebecca to kind of get that current and update our needs as required. We're currently funding this year about 5.7 annually. Tashi's identified that 6.2 is kind of the number, so we aren't that far off there. And then we do kind of look for opportunities to try and shrink that gap a little bit just with our joint tendering. We've done culverts in-house that have saved us some money, so I don't think we're too far from where that number needs to be. Rebecca, I'm not sure if you want to answer any additional to that.
No, basically, as Matt indicated, the asset management plan is a constant cycle. So every 2 years, the bridge studies need to be updated in our asset management plan. And even with the replacement costs in this recent OSIM report, we reported last cycle was 306 million, and now it's at 318. So these things need to be updated on a continuous basis, just like the road needs study and with inflationary increases and things like that. So they do get updated on a regular cycle now that we have the plan in place.
Thank you. Any further? Go ahead, Councillor Lane.
Thank you, Mr. Warden. Through you, just as we have some experts in the room, and looking through your report of all the structures and the age and so forth, are we better off to go with box culverts than regular culverts? It just seems we have some box culverts. I'm pretty sure I saw one in there that's 100 years old. Are they outlasting? And then I think the other culverts used to be a lot cheaper, but I'm not sure they are a lot cheaper anymore.
I think when the opportunity presents, we generally would recommend box. I mean, you have to do hydraulics, so there's certain other, but in terms of straight up condition and lifespan, box culverts, like a concrete box culvert, you can get. I mean, we designed it for 75, but 100 is not uncommon with very little maintenance. The problem with the steel culverts, the steel culverts are still going to be less expensive to purchase, but when you factor in closing the road, excavation, all the other work, they're still going to be, ultimately the cost will be higher, but I think if you looked at as a sort of a life cycle cost, net present value, you'd probably find the culverts are favorable. And the problem also with the steel culverts is a lot of corrosive environments when you get the runoff from farmers' fields and stuff, so they don't tend to perform. I mean, you can put polymer-coated different materials, but that's generally all in theory when they say they'll last 75 years, but typically it's 50 years is probably pushing it in some cases. So yes, I would say in general the box culvert is for sure a better option when you're replacing culverts.
Can I follow up, please? Just so you know you're talking to a farmer here, eh? And I think it's more the salt on the road than it is a runoff of the farmer's field. But anyway, putting my 2 cents in there.
Thank you. I'll take Councillor Densham, and then I'll go to Councillor Broad and St. Pierre.
Thank you, Mr. Warden, and through you. Thank you for the presentation. I just wanted to be clear on the information. You said that North Stormont was not in some of this presentation. It was not on the maps, but it was in the numbers. Is that correct?
No, it's because North Stormont we did as a separate assignment. It wasn't bundled with the SDG package, so we haven't included any of those results in this presentation.
Okay, so that has the potential to add to the price tag then?
Well, no, because the numbers we've provided in terms of replacement costs, and that's just strictly Stormont Dundas. It was just the maps that we.
Yeah. Okay.
Yeah. It was just those last couple of maps we presented were the sort of combined, because they're the only thing that we didn't include the North Stormont. So.
Okay. So the numbers include all the county roads?
That's correct, yeah.
Perfect.
Yeah.
Thank you.
Go ahead, Councillor Broughton.
Yeah, thank you. Through you, Warden, and either for you guys or maybe even Matt, Rebecca. So to add on to Councillor McGinnis' statement, currently 2026 we're spending 5.2 million, and we're using $500,000 from reserves to fund that. So that's really we're funding at 4.7 million. The expected average over the next few years is 6.7. So obviously we have a shortfall, which we'll work on in our budgeting process as we continue to work on asset management planning. But my question is the 2026 budget, the Cass Bridge replacement, and all the other culverts we're doing reflective in the first year plan, or is that plan year one really 2027's plan?
Did Matt want to jump into that one?
Yeah, sure. So and I see where you're coming from with that one. Yeah, there is a bit of a disconnect just on that plan, just because just kind of the sequencing of it really, like that design for CAS kind of developed off the 2023 plan and jumped into budget. So yes, that wouldn't be reflective of that. So we are always trying to kind of design ahead. I mean, my ultimate goal would be to kind of have 2 years of projects ready that we can shift around and prioritize. Ideally, we keep kind of creeping that annual budget number up incrementally. You know, use reserves on the highs and hopefully save on the lows. I believe we do have a contribution to the Boundary Road Bridge Reserve included in there as well. But yes, we'd be happy to creep that number up a little bit, Councillor Broad.
Yeah, follow up, Warden, just to be clear. So in the bridges that need to be replaced in the chart, is Cass Bridge in that chart?
So in the 2023 cycle, it had it sooner. In Tachi's version of it, it has it later in the cycle, but more as a maintenance need to address the condition of the girders. So as we got down the road on that detailed design, it kind of like, as he spoke to it, the replacement costs and, you know, the early concept of design is very, very early on, and until you get down into that detailed, you know, things can grow or things can shrink. So that's kind of how that developed. But no, it was pushed off a little later in this new plan.
I'll take Councillor St. Pierre.
Yeah, thank you, Warden. And just getting a little technical on this question, but I recall working on a couple culverts in Stittsville, CSP, where we added some zinc coating and a membrane to increase the lifespan of the culverts. Is that something that we can look at that would, or are the designs of the culverts today already kind of including these types of mechanisms for the lifespan? So I'm just looking to see if there's any added mechanism we could put in place that, yeah, maybe it's additional cost, but may add 20 to 25 years on that life cycle.
Yeah, I mean, there are things you can do. I know if we flag a culvert for a rehabilitation or replacement, we don't just well, unless it's in really poor condition in terms of structurally performing, deforming, and that sort of thing, but we'd always, like when we're doing the rehabilitation, we typically look at options, so there's not necessarily jumping right to replacement. There are scenarios that you touched to. We've done invert liners, but it would all depend on the condition of the culvert and the shape. So there are some, yeah, but in terms of preemptive, I mean, no one usually does that because then no one likes to spend money when they don't need to spend money. So most of the time, everyone will just wait till the culvert needs some form of work and then jump in. So if you do it soon enough, you can do rehabilitations. It's just if you wait too long, then you end up having no choice but to replace. So,
just subsequent, I guess I'm just wondering about new culverts putting in, installing new culverts, if we shouldn't be looking at the types of mechanisms to increase the life cycle as well.
Yeah, I mean, I guess typically when you do a new culvert, if you're looking at, well, concrete box culvert, they'd probably nothing to do, but if you're looking at a steel, I mean, they would come, there's ways to design. I think the manuals will typically tell you, depending on the environments, you can select materials. I don't know of anyone who would go preemptively. I've never seen it done. It's like additional, you would just oversize the wall thickness if you needed to, or use a polymer coating or aluminize. So there's, you know, those things theoretically should last, but yeah, typically they're not. You don't do additional work when you're installing it. You just pick maybe a thicker wall or a different material treatment. So, well, I guess that answers that would be yes. You do that sort of thing. But
yeah. Like I say, Warden, I worked on a couple culverts in Stittsville where we actually, the city of Ottawa actually asked us to do that extra work just to get the more lifespan. So it might be something we may want to think about because it may be a cost savings at the end as well. So just something to.
That was on like a new culvert you were installing?
Yeah, very new culvert. Yeah, 2 of them on Pool Creek.
Okay.
Thank you. Any further questions? Seeing none. Matt, you're all good. Thumbs up with perfect. So thank you very much for the presentation, and you're more than welcome to stick around if you wish. We will move on to our action request, item 6.3, in regards to EVB Engineering and the Main Street in Alexandria's design. We'll have Cameron come up and speak on that.
It's moved by Councillor St. Pierre, seconded by Councillor Lang, that the Council of the United Counties of Stormont, Dundas and Glengarry accept EVB Engineers' revised design proposal for the County Road 34 Main Street and Mill Square improvements totaling $317,524 plus net HST, and that Council approve the county's portion of the shared design costs totaling $158,763.50 plus net HST, and that the Director of Transportation Services be authorized to sign all necessary documents to give effect to the contract.
Thank you. So I apologize. I guess Dana is joining us as well. So good morning, gentlemen.
Yes, so good morning, Mr. Warden, members of council. This report outlines a revised design proposal from EVB Engineering for the County Road 34 Main Street, Mill Square, and County Road 10 improvements, which is a cost-shared project with the Township of North Glengarry. Staff are recommending that council approve EVB Engineering proposal for the amount of $317,524. So just a little background. In late 2022, Jacobs Engineering was retained to complete the detailed design following the environmental assessment. Due to differences in the scope of underground infrastructure design, the assignment was concluded by mutual agreement prior to completion. To maintain continuity, Council approved staff in January 2025 to engage EVB Engineering, the second lowest proponent for the original RFP. So since that approval, county staff and the Township of North Glengarry have reviewed the work completed to date and refined the remaining scope to maximize the use of existing information and avoid duplication. This information was provided to EVB Engineering, who prepared a revised work plan and cost proposal to complete the design. So the revised design cost is $317,524 plus HST, with the county share totaling $161,556.21, including net HST. This amount is fully funded within the approved capital budget within the project surplus, with a projected surplus of approximately $98,000. So EVB's revised proposal reflects the adjusted scope, incorporates previously completed work, complies with the purchasing policy, and allows the project to proceed without further delay.
Thank you. Any questions? Go ahead, Councillor Bergeron.
Thank you, Warden. My question is, so the contract with Jacobs, how much did we have to pay them for their portion of the work? That's question one. Question two is, I see that in the contract, North Glengarry pays for a portion of the contract. So did they pay for a portion of what Jacobs did? Yeah, I think that's it. Thank you.
Yeah, that's a great question. So we've spent to date about $62,000 paid to Jacobs Engineering, and that would have been from contract award in 2022 up until when the contract was terminated in 2024. We did not recover any of that $62,000 from the township. Most of that had to do with maybe some survey work, review of background materials, preliminary design of the roadway cross section, and so that was never really billed back as a shared cost with North Glengarry. The second part of your question was, I believe, about, sorry, what?
No, I just mentioned that the township had paid for, or is paying for part of the new contract, and if they were doing, so you did answer both questions.
Oh, okay.
Wait a minute. The third question is, was EVB able to use some of the information that we got from Jacobs?
Yes.
To continue?
Yeah. In short, yes, but not everything. And so there's a tunnel that goes under, and as actually shown on the map in our just past presentation, there's a tunnel that goes under County Road 34, and we're going to be rehabbing it. So that was the result. Part of Jacob's work included a fulsome investigation of that and full report on life cycle costing for us to move forward with the most cost-efficient rehabilitation technique. And so that's one thing. I might estimate that to be about $20,000 that we can reuse. There was going to be some preliminary, the topographic survey, which we will also be able to reuse. But in any sort of engineering proposal, there is typically review of background information, and some of the very early preliminary designs. Those are the things that we will not be able to move forward with. Yeah, no problem.
Thank you. Any further questions? Seeing none. So but you did read that motion, so all in favor? Motion is carried. I believe, Cameron, you can stay there. Next item is the reduced setback request at 21043 County Road 26.
It's moved by Councillor Lang, seconded by Councillor Densham, that the Council of the United Counties of Stormont, Dundas, and Glengarry receive the following report for information, and that Council deny a minor variance for a reduced setback of 12.2 meters from the center line of County Road 26 to permit the demolition, reconstruction, and extension of a building at 21043 County Road 26.
Thank you. Go ahead, Cameron.
Thank you, and through you, Warden. So this is a setback permit request. You know, we do get these quite often. Sometimes we will use extraordinary and peculiar circumstances as sort of the logic for approving setbacks where a building may already be somewhat close to the road. In this case, the house is quite close to an intersection, and so the concern is that anybody traveling along that road that may leave the roadway could, I guess, run out into the front yard. And so that's sort of the reasoning coming and the recommendation coming from Public Works and Transportation Services is that we do not approve the minor variance. That being said, it is, council does have the authority to disagree with staff and give that minor variance. There have been no recorded accidents that we are aware of. It is a low volume road, and so we just wanted to bring this to council for their knowledge and awareness, and happy to answer any questions.
Thank you. So before I do go to question, there's already a veranda on the existing house when we look at the picture. Is that increasing or is that going to be demolished and just rebuilt there? So maybe just before I go to questions, do you have comments on that?
Yep, and through you, Warden. So the intent of the building permit going through the township and the request for the setback permit from the counties is for the applicant to rebuild the garage at the back of the house and put a wraparound porch on the front of the house. So the Transportation Services Department has no issue if they would like to proceed with the garage extension or addition at the back of the house. It's really the wraparound portion that's getting closer to the radius of that curve is where we have some concerns. Does that answer your question?
Well, I'm just not sure. So is it bigger than what we're seeing here? So they're going to
yes,
expand?
I believe the report may have had a square footage increase. I think it was about 150 to 600 square feet. And it's not coming any closer to the county road, but it is getting closer to the intersection by way of being a wraparound porch.
Perfect. Yeah. Okay, I'll take question. I see Councillor Lang arms up. Go ahead.
Thank you very much, Mr. Warden, and through you. Thank you for the presentation, and I appreciate staff's point on this. You guys have a job to do, and it's mostly to follow the rules. And I'm glad you brought it to us because it gives us the opportunity to look at the nuances of it and to see if there's a way that we can make this happen. So I'd like to speak in favor of passing it, not as is written, but in favor of allowing them to have the wraparound veranda. And I'll make a couple of points. This is on County Road 26, and as was stated in the report, there's about 239 cars a day. And if you remember I guess it was during the year last year, I don't know if it was summer or fall when it was, we had our road rationalization study and the traveling road tour that Ben and Maureen and myself, wherever I could, went to the counties. This road is one that was slated at the time to go back to the township as a local road. The reason being the 239 cars and that 90 or more % of the traffic is local. Anybody coming off the 401 will either use the Curry Hill Road, which is kind of 23, I believe, or 34 to get to wherever they're going. So it's more local traffic than anything else. Now that road rationalization study, I guess, as Ben had left and Cameron has come in to place them, it's kind of on hold for now, but hopefully we will maybe kind of wrap that up before the end of this term is my wish. So if this road goes back to the township, which I believe it likely will, we would not have an intersection similar to what's there because it's an actual T. We would put a stop sign as you wouldn't have a township road that doesn't have a stop sign at the T, that has one going through, it just wouldn't happen. The only reason there's no stop sign now, I believe, is because it's a county road that makes that jog. So I believe it would solve any issues there. And I do know I've had residents ask me if the counties would be interested in putting a stop sign now, and I don't know if that's something maybe for a later discussion, but it could be brought up. The situation with the veranda that is there is about 8 feet out from the house. The new veranda proposed looks like it's 7'9" to the pillar, so I assume it's an 8-foot veranda as well. So it's not really going to be any closer to the road, but there would be more square footage. So to me, if you were going to put a veranda on the east side of the house, and the counties have proposed that they come back and apply to rebuild that veranda, it seems kind of silly that we wouldn't just let them join the two verandas, because you're going to have a veranda there one way or the other by look of it. It is existing now. So whether it's a little longer does not, to me, affect anything other than it is a little closer to the intersection, but because it's an actual T, people have to come to pretty close to a stop there to get around that intersection. You can't take it at 80 kilometers an hour. There's just no way you could do it. So I'd like to speak in favor of it. I think if we do, the situation will be that there will still be an existing veranda the same distance from the road it is now. It won't be any closer. It'll be a little larger, maybe a little buffer, so that if somebody did hit the house, they don't end up in the living room. They just stop at the veranda. And it's something to think about. And the other thing, if we pass this, then I think a young couple who is living and working in this community, they own a dairy farm there, will have the house of their dream. And I don't see any reason we couldn't allow that to happen. So thank you.
Thank you. I'll take questions from Councillor McDonald.
Okay, thank you. Thank you, Mr. Warden. I'll be very short. I agree with Councillor Lang. I think it's already existing. It's 239 cars a day. There are properties, I can't see that safety is an issue. We have properties on County Road 2 that are closer than that to the road, and with several thousand cars a day. So they're not changing anything. The distance is the same, it's just longer, and I don't see why we wouldn't be approving this. Thank you.
Thank you. Any further? Go ahead, Councillor McGillis.
Yeah, thank you very much, Mr. Warden. I agree. I'll support Councillor Lang's endeavor to keep the veranda wrap around. And I think because what Councillor McDonald said, the same things, limited traffic. Possibly, I hope to see a stop sign there one day, make it a little safer. But as what Councillor McDonald said, there's a lot of houses, not just on number 2, but all over the SDG, where the houses are really close to the road, where there's not a problem. And there could be an accident anywhere, if you want to use that, say, an argument. So I think I'm going to support Councillor Lang's proposal.
Thank you. We're kind of going that way. I believe, Madam Clerk, can I see a nod if we look at maybe so go ahead with the new motion, Madam Clerk.
Through you, Mr. Warden, if Councillor Lang is fine with putting this forward, I have a motion to withdraw the motion to deny. So we'll move a motion to withdraw that original motion, and then I have an additional motion to approve. So the motion to withdraw reads that the motion to deny a minor variance for a reduced setback of 12.2 meters from the center line of County Road 26 to permit the demolition, reconstruction, and extension of a building at 21043 County Road 26 be withdrawn. Are you fine with that?
Any further questions? Seeing none, all in.
Oh, we need a mover seconder as well. Okay.
Go ahead. Do we need a mover seconder for the next one, Madam Clerk?
Yeah, and we've got one for this one. It's Councillor Lang and Councillor Densham.
Yep. So one more question. Go ahead, Councillor McGillis.
Getting back to what Councillor Lang said, is there a possibility that you can look into possibly putting a stop sign? Could you maybe bring back a report to us to see if it's an issue?
Yeah, through you, Warden. Yeah, if that's something that council would like to see back, we can certainly bring a report. The other thing I should have probably mentioned is that there is a 40-kilometer-an-hour advisory tab leading into the sharp, what we call a sharp curve, or the turn. And I just probably should have mentioned that as part of the table discussion. So there was a yield sign. This would have been many years ago. I don't know exactly when it was changed, but it would have been about maybe 2 or 3 years ago. It was changed to a through with no yield. The township road at both curves are stop controlled.
Go ahead, Councillor Fraser.
Thank you, Mr. Warden. And just to Councillor McGinnis's comment about the stop sign, I'm not in favor of that. I do argue with residents, discuss with residents in North Dundas about the policy about municipal roads stop for county roads don't stop for municipal roads. And because of the situation that we all have in our villages, we have a county road that runs through it, and we do have people, at least in North Dundas, advocating that the municipal road should cause the county road to stop. And so I don't appreciate that discussion. I like the idea that the municipal roads stop and the county roads continue. So I'm not really in favor of that discussion, if it comes up as a straw poll on that. Thank you, Mr. Warden.
So I believe that looking at a stop sign is another total different ask here. So, and I think there's strict guidelines that I think Public Works would look into. So it's not just a strict. For now, not speaking on a stop sign, just asking if the motion still is carried. So right now I do have a mover seconder, so I'll put it to a vote. So all in favor of removing the motion is carried. And now, do you need a mover seconder?
That's right. I'll need a mover and a seconder to approve the approval.
Moved by Councillor Lang, seconded by Councillor Gaindel.
And it reads that the Council of the United Counties of Stormont, Dundas, and Glengarry received the following report for information, and that Council approve a minor variance for a reduced setback of 12.2 meters from the center line of County Road 26 to permit the demolition, reconstruction, and extension of a building at 21043 County Road 26.
Any questions on the wording of the motion? Seeing none, all in favor? Motion is carried. Thank you very much. Moving on to IT, item 6.7, in regards to a server cluster approval. Madam Clerk.
It's moved by Councillor Broad, seconded by Councillor St. Pierre, that the Council of the United Counties of Stormont, Dundas, and Glengarry approve the purchase of the server cluster replacement from Dell Canada in the amount of $175,497 plus applicable HST.
Thank you. Welcome, Mike, and go ahead with your report.
Thank you, Mr. Warden, through you. Good morning, Council. So the server cluster is due for replacement this year. This was approved in the 2026 budget deliberations. After the budget was passed, we did put the order through to preserve pricing, favorable pricing from Dell Canada. The purchase was made through our agreements with OECM, the Ontario Education Consumer Marketplace. So they put out RFPs on behalf of publicly funded organizations, and we've been a member of this agreement for the past 8 years. So the order was put through. Update since the meeting was pushed back a week. We do have the servers on site installed. We are in the testing and authorization acceptance phase of the project. So now they're looking to get paid, and because the amount is above Madame CEO's approval limit, we're asking Council to approve the invoice. Thank you.
Thank you. Any questions? Seeing none, all in favor? Motion is carried. Thank you, Mike. Moving on to tender awards in regard to Pittston Creek Bridge rehab. Matt.
It's moved by Councillor Densham, seconded by Councillor Bergeron, that the Council of the United Counties of Stormont, Dundas, and Glengarry accept the tender from Willis Care Contracting Limited for the rehabilitation of the Pittston Creek Bridge at their unit prices totaling $977,000, $809 plus net HST, and that Council approve the county's portion of the shared tender price totaling $488,904.50 plus net HST, and that Council provide the Director of Transportation Services the authority to sign all documents to give effect to the contract.
Thank you. Go ahead, Matt.
Hello, Council. What you have here in front of you is the recommendation for the award of the Pittston Creek Bridge. This is a joint boundary bridge that falls on the border of SDG and Leeds and Grenville. Therefore, as outlined in the Municipal Act, we are responsible for 50% of the costs associated with the work. The bridge is located on Haynesville Road on the South Dundas side, which then changes to the Pittston Road on the Edwardsburg Cardinal side. In 2022, we embarked on a joint RFP with Leeds and Grenville to begin reviewing the structure and identifying the specific needs for a detailed design. A deck condition survey confirmed that a full deck replacement was the preferred option for this bridge. Along with this, we also will convert the expansion joints to a semi-integral to protect the existing girders and upgrade the barrier system to current standard with a raised curb and through I-beam rail. For this project, we are working with the municipality of South Dundas and Township of Edwardsburg Cardinal to have the abutting sections of road paved prior to the bridge construction. Both partners have identified this as budgeted work for 2026. We are targeting a road closure start date of June 15th, which should allow enough time for work to commence, as well as assist some of the local farming operations with their seasons, getting their season started. We have been in contact with both DFA and Dundas dairy producers to discuss the challenges around the closure, as well as some of the local residents. As you can see, we had a great turnout on the bid sheet with 9 replies. We benefited from a low price from Willis Kerr to start the bidding season off on a good note. As stated in the resolution, while the bid price is $977,809, we are asking for approval for half of that, at approximately $489,000. Just for added information, Leeds and Grenville approved their half of the project on January 22nd at their council meeting. If approved, we would take care of the contract administration for the project and just bill back any costs incurred during the work. So with that, if you guys have any questions, here to help.
Thank you. Any questions? If we get them all coming in at that number, I think the HP engineering report will be in good thing. So seeing no questions, all in favor? Motion is carried. Moving on to bylaws, item 8.1 in regards to our 2026 tax ratio. Madam Clerk.
It's moved by Councillor Fraser, seconded by Councillor Densham, that bylaw number 5519, being a bylaw to establish property tax ratios for SDG counties and municipal purposes for the year 2026, be read and passed in open council, signed and sealed.
Thank you. Welcome, Rebecca.
Good morning, Council. So I'm able to present the next two bylaws together as they marry up to each other. The first bylaw is the tax ratio bylaw. This bylaw establishes the 2026 tax ratios, which have remained unchanged for many years, with the exception of the aggregate extraction class that was put in place about 3 years ago. So these ratios distribute the tax burden among the property classes, with the residential property class always equal to 1. So these ratios have no financial impact, however they are required in order to set the tax rates. So if I have any questions, I'd be happy to answer, or I can move on to the tax rates bylaw.
Any questions on the ratio? Seeing none. It's two separate motion, Madam Clerk. Yeah, so I'll put this one to a vote. So all in favor? Motion is carried. And I'll move on to the 2026 tax rate.
Okay, so the tax rate bylaw establishes the tax rates for 2026, resulting in tax revenues of $65.5 million based on our 2026 budget meetings. The 2026 residential property tax rates will see a 4.48% residential tax rate increase in county taxes, which is an increase of just over $3.7 million in revenues from 2025. Once approved, this bylaw will be shared with the local municipalities, as the rates need to be included with their property tax bills to the property owners. So this also approves the 2026 budget.
Thank you. Any questions in regards to that? Go ahead, Madam Clerk.
I'll just read the motion. It's moved by Councillor St. Pierre, seconded by Councillor Broad, that bylaw number 5520, being a bylaw for the purpose of adopting and raising the general upper tier levy for the year 2026, be read and passed in open council, signed and sealed.
Any questions? Seeing none, all in favor? Thank you. Motion is carried. Moving on to IT services agreement with the Raisin River Conservation Authority.
It's moved by Councillor Broad, seconded by Councillor Lang, that bylaw number 5521, being a bylaw to authorize a memorandum of understanding between the United Counties of Stormont, Dundas and Glengarry and the Raisin Region Conservation Authority for the provision of IT services, be read and passed in open council, signed and sealed.
I'll take it back. Raisin Region, not Rivers. So go ahead, Mike.
Thank you, Mr. Warden, and through you. So as previously discussed, we've been working with Raisin Region Conservation Authority for SDG Counties IT to provide services to them. And we've created this MOU to formalize that service and that agreement. Basically, it's going to be cost neutral for the counties. We're going to realize revenue of $30,000 per year through this agreement, adjusted annually based on CPI. Yeah, it's fairly straightforward service to provide. We're not adding any resources at our end, so basically we're able to reduce the taxation for the IT department by that amount as well. So happy to answer any questions.
Thank you. Any questions? Go ahead, Councillor Lang.
Thank you very much, Mr. Warden, and through you. Very happy to support this agreement. Just a question, and I did read it somewhere, and I can't find it here right now, but we have a time that any party can get out of the agreement, have to give so many days' notice. Just because everything's up in the air with the conservation authorities and how long we're going to remain as Raisin Region and, this sort of thing. The options, like if we're not Raisin Region for a full year, is that doable? Do they still pay the $30,000, or is it, 6 months is $15,000, or this sort of thing? Just what happens if the province does amalgamate the conservation authorities?
We've had that discussion, that conversation, and Ms. McDonald felt that we would realize the full year. These things take time, and there is an out clause. It's 6-month out clause. So if we make the first 6 months, then we would see the revenue for the following 6 months. If they decide in March that the province is amalgamating everybody and we're done, well, we're going to be out that $15,000. But we felt that there was the risk of that was fairly low.
Thank you. Any further questions? Seeing none, all in favor? Motion is carried. Moving on to our consent agenda, Madam Clerk.
It's moved by Councillor Bergeron, seconded by Councillor St. Pierre, that all items listed under the consent agenda section of the agenda be received for information purposes.
Thank you. Anything that want to be brought up to our consent agenda? Seeing none, all in favor of accepting the report? Motion is carried. Boards and committees. I guess it starts with Warden's report. So it was a fairly eventful month for my first month. So I got to attend the AGM for the Eastern Ontario Wardens Caucus, along with our past Warden Lang and our CAO Maureen Adams. So it was a good opportunity for me to walk through. They presented their strategic plan to the new members, their provincial budget recommendation, as well as briefing us on some of our delegations at Roma. On Thursday night, we had the opportunity to go out with supper with all our past warden as a bid farewell, and a good opportunity for me to meet the new members. On Friday morning, the room was filled with special guests, including MPPs, along with Minister Thompson and Minister Quinn, who they brought greetings. And again, I'd like to thank both Martin and Maureen for their much appreciated guidance in my transition to the warden seat. Moving to Roma, so through the delegations that we had with Roma, 3 of the key priorities that a lot of it was focused on was creating a paramedic college, a regulatory college in Ontario. Second is partnering towards a fair and transparent OPP billing and timelines, which we've had many discussions on that here at this table, as well as modernizing the outdated POA fine system. So those 3 were ones that were brought up to different ministries, as well as the opposition parties, to show how strong the position or the partnership is. I was not aware, but the EAOWC represents 1.1 million residents across 103 municipalities. So 7 years on to the county chair here, I was not aware that it was that magnitude when you're thinking it's almost a quarter of the municipalities of all of Ontario. So as well, on the county side, so I think most of you were present at Roma. I took part in 3 delegations, mostly in a supporting role. So the first one was in partnership with North Glengarry. We met with the Ministry of Infrastructure on Alexandria Main Street, and I might get Councillor McDonald to maybe expand on that.
Sorry. Yeah, so we had a meeting with the Deputy Minister, or the PA. It went very well. He was very knowledgeable on our file in North Glengarry, knew that we weren't 100% complete with our asset management plan, which has now been sent in. He also knew that we didn't get money in collaboration with the counties on the bypass through Alexandria. and, spoke with his staff, even at that point, even mentioned, is there any way we can get the money outside of any programs? And then one of the staffers said there's a program coming out, that's going to be announced tomorrow, and which it was. So I think that's one of the programs that we're hoping to partner with the counties on. So overall, I thought it was a very good. We were very well received, and I think it went just always good to get in front of them. Thank you.
Thank you. Second one with the Ministry of Education, where we were looking at seeing about being at the table with them, and also in regards to the trustee reform and timeline. So I'll maybe get Councillor St. Pierre to elaborate.
Yeah, thank you, Warden. So yes, we did meet with PA Billy Pang. We had about 3 points that we wanted to discuss. One of the ones was we've got 4 school boards, 28 schools across our region, and we want to reiterate the importance of the county being strong partners with each school board along with the province. So he seemed to be very receptive to that. We were looking for some guidance on how the province could help with that relationship piece. So we'll just continue having discussions. The other 2 was the trustee reform. As we know, there's been many discussions from the ministry's office on trustee reform and the position and the direction they're going to take. Mr. Pang was not committed on telling us exactly what the approach was going to be, but he did say that announcement will be forthcoming. We did kind of pressure him a little bit, knowing that we have municipal elections coming up within 8 months or 9 months. So within the next 4 or 5 months, we probably will hear some kind of announcement. I think our committee is in agreement that some type of reform needs to occur. And then, again, the best news of the day was rural schools will remain open, that the moratorium on school closures will not be lifted. So he continuously said that to us. So it was very positive. So we'll just continue meeting and hopefully continue the discussions with him.
Thank you. And my third one, moving on with the MECP and Minister McCarthy, about what the future holds for the Conservation Authority. I'll get Councillor Guindon to maybe give us a briefing.
Yeah, through you, Mr. Warden. So yes, we met with the Minister of Environment to talk about the proposed changes to the conservation authorities. So right now the plan is to go from 36 conservation authorities down to 7. So the counties met with the minister, as well as in the delegation we had 2 of our partner CAs, being South Nation and the RCA. So we talked to them broadly about 3 concerns. The first with respect to the proposed boundary of what would be the St. Lawrence Conservation Authority. So we suggested potentially a smaller organization, and provided options in terms of different boundaries. The second concern we raised was with respect to the timelines. Currently, they're hoping to have the transition occur to align with the change in the municipal term. We have concerns given that that's 9 months out from now, so we hope to see a longer transition period. And finally, we asked for communication to come forward sooner rather than later with respect to the governance model. The CAs don't really have an understanding of what the representation would look like. I think our comments were well received, and we're hoping that we'll get some more information back from the minister within the next few weeks or months.
Thank you. And the fourth one, I was not present, but I believe Councillor McDonald would elaborate on the South Glengarry delegation.
Yes, so this one was a South Glengarry delegation, but it has to do with all of us. So it was with the PA of Finance, and it's one that Councillor Fraser and I have talked about quite a bit. So it was just how OMPF or whatever funding model does not account for, I wouldn't say the burden, but the responsibility of feeding Ontario that rural municipalities have. So it was that 25% for farm tax benefit. And in this case, we're not asking like local farmers to pay, we're asking for the province to kind of make us a little bit more whole, again, reflecting on the responsibility of rural Ontario to feed all of Ontario. The amount for South Glengarry alone would be about $3.7 million. I think it's similar for North Dundas and many of us around the table. I know it's kind of being mentioned. We did use some of the county's previous information for that. They received it. I don't know if anything's going to change, but I'll anecdotally call it the milk tax, and if I'm around the table for a little bit longer, I might persist with that message.
And if I can add, if you don't ask, you won't get. So I think it's always beneficial to get their attention when we are up there. So with that said, moving on to joint liaison. I believe it's Martin. Anything?
I don't believe we've had a meeting.
Sorry, that will be falling onto my. So now I was just reading on to. I did get the agenda, and I apologize. They sent all the meetings through my agenda. I'm just not sure. I'll interfere. Maureen, would you have the date for the next joint liaison meeting?
Through you, Mr. Warden, I believe it's early March.
Early March.
Yeah.
Perfect. Thank you. Moving on to Library Board, Councillor Broad.
Thank you, Warden. No meeting in January, but just a reminder, our upcoming meeting is February 12th in Chrysler. It is open to the public. We meet in the library. We start at 4:30 with our book club. So to my fellow councillors, don't forget to read your book, as I'll be questioning the group on February 12th.
Just so
way too many pages for you.
Just so you're aware, it's a tough read. We'll discuss it further at the meeting. Moving on to the Police Service Board. Again, I'll look at Martin. Anything new, or Brian?
Do you want to take it, Brian, as our chair, or do you want?
Yeah, go ahead, Brian.
I can add in anything.
I'll start over. I can say that we done a job evaluation report performance for our detachment commander. We discussed four different criterias, which was the traffic safety enforcement, emergency management, collaboration, indigenous community relationships, and mobile crisis response team, which the detachment commander supported very well. I can also say that the end result was very positive for the detachment commander. And I had a meeting with him at the OPP office, and I signed it, and he's forwarding the report to the commissioner. So everything worked out well there. I was wondering if I should mention anything about the billing for 2026. Sure. Okay. The result of the billing for the year from January 1st to the end of 26 is it equates to $11,306,583, and the cost to the counties monthly will be $942,215, and that will cover 30,245 households SDG, commercial and industrial also 1,832, and the total properties will be in total will be 32,077. So that adds up to 134.04 per household. So that's pretty well the cost of the cap billing for this year. So there's no surprises. And everything else is good. Todd Lalone, he's our new director for, the same director, but for Zone 2 in our area. So there's two other ones, but Todd was successful in the boat there, so I welcome him back. Is there anything that you want to add?
Thank you,
Councillor Rosling.
Councillor McGillis. I'll just add a couple of things in his report for the last quarter of 2025. He did mention that traffic safety showed a marked improvement with less accidents and less tickets, sort of thing. So they've been doing a push on social media as well, and I see it even right across the province. It's coming on our social media that they're trying to remind people to be safe. So, and it seems to be working. So hopefully that'll continue on. He spoke a little bit about community engagement, and they really have a strong push to be engaged with the community. The mental health response, Brian mentioned already that we have the second individual up and running now, so that's a great thing to have. We're covered a little more than we were before. It's pretty hard for one person to cover all of SDG, and especially if they can only work so many hours. So I think that's something we've all supported. It's good to see that up and running. And he did, I don't know if he got to everybody, he did do a council engagement in the fall, and we got to our council. Hopefully he got to everybody else's council and gave us an update. So it's good to see that, and we like to see him coming locally. So just a little bit all that. Thanks, Brian.
Thank you. Moving on to Eastern Ontario Wardens, or Health Unit, Councillor Williams, anything new? Cancel. Thank you. Glen Store Dunn Lodge. Councillor Broad.
Yeah, thank you, Warden. Councillor McDonald and I attended the meeting January 21st. As I reported the last time, we've had a change with councillors from the City of Cornwall. Caroline Huber stays, Elaine McDonald, and Dennis Sabran now joins us. And at that meeting, we elected Dennis Sabran the chair. It's 2-year terms. I was chair for the first 2, Cornwall for the second 2. So Dennis will take on leading the board for the remainder of this term. Just kind of a report from the administration and the board, continuing to have open recruiting, unlike the Winchester Hospital, not fully staffed, so they continue to report. Ministry was back in since our last time, and an inspection and 2 issues to follow up, but nothing of significance. Capital improvements continue to be ongoing as we dip below the 97% as we are working on painting and upgrading rooms. But we do have a wait list of over 300 people, as Charlie kind of talked about earlier, how that works. And finally, the administrator, Kathy Fisher, who's been on the job now 6 months, really adamant about our terms of reference. So we're doing a review of our terms of reference, and we found some opportunities to do better at. So I think Councillor McDonald might be bringing back some ideas and some thoughts on make sure our terms of reference is solid. She's found some outages within kind of the board and the City of Cornwall, so we'll work through those.
Thank you. Looking at Andrew in regards to St. Lawrence River Institute, nothing to report. Councillor Bergeron in regards to Raisin South Nation, nope, seeing none. Municipal Advisory, Algonquin, Councillor Fraser. How about Rural Education Committee? I think Mark brought back a report from Roma. Social Development Council, sorry. So I apologize. So Regional Incentive Program, Councillor Densham.
Yeah, thank you, Mr. Warden. There wasn't a meeting yet. However, I do want to point out the fact that the Regional Incentive Program did kick off Monday, January 26th, so it's now open for submissions by businesses in SDNG. The deadline to submit the RIP application is Friday, March 13th at 4:30 p.m. And then the Approvals Committee will meet sometime later in March, and hopefully the successful candidates will come to Council Monday, April the 20th, and we'll be looking at an approval for May 1st. So I encourage all small, medium, large businesses who wish to apply to please do so quickly before the timeline runs out.
Thank you very much. Now moving to Social Development, Councillor Williams.
Thank you, Mr. Warden. Since the Social Development Council merged with the Eastern Ontario Training Board, they've been continuing to work on that evolving relationship. The board may or may not change moving into the future to perhaps merge with the Training Board's board rather than have 2 separate boards. That's a question that's being looked at right now, so I'll keep you updated. Thank you.
Thank you. SDG Forest Working Group, nothing to report, Martin. And last, Border Mayors Alliance, Councillor Broad.
Yeah, thanks, Warden. I can't remember if I updated this in December, but we did meet again in December, continuing the alliance. The City of Windsor are going to continue to fund the alliance for the fiscal year 2026. So thank you, Mayor Dilkins, for picking up that tab. We'll continue to meet. We did have a session at Roma with a lot of the mayors, and we're just continuing to monitor, update us, and I'll update this group if there's any changes.
Thank you. Moving on to item 11 with the administrative update. Madam C. Sorry, go ahead, Councillor McGillis.
Maybe I'll just direct this to Councillor Fraser. The Algonquin land claims, has there been any movement at all on that over the last year?
I've not received any communication about that at all. Nothing.
Thank you. So Maureen, before you step in, one thing I did forget. So last Thursday, I participated in a prep session in regards to the emergency sessions that we that took place this weekend. I'd like to thank Catherine, Todd, and I think a lot of the staff that were here. Most of you guys participated. It was I got my feet wet. It's kind of it opens your eyes when you look at now they're laying it on heavy, but I mean that's what the exercise is there for. So again, I think it was a great success. It's nice to see all the partners that we do have once you step into that room when you're looking at Red Cross, Human Service, everything that, and then the trailer outside, you've got your people with boots on the ground. It's anyways, it was well worth it, well put on, and I think they deserve a good hand of applause for this whole weekend that went by. And leave it as a mock and not the real thing. So go ahead, Maureen, on administrator's update.
Thank you, Warden Lang, and thank you for the comments regarding the exercise this past weekend. I think it was a huge success, and we have had lots of thank yous from our partners as well to be able to include them, and there was quite a bit of planning, but overall, fantastic. In my report, I have a few things just with respect to my calendar for the month of December. Geez, that seems like a long time ago. And then looking forward at a few key dates on a go-forward basis, our next county council meeting is February the 17th, but a week from today we have our committee of the whole meeting on February the 9th, just to make sure it's on everybody's radar. Also would like to mention on our schedule that Good Roads is coming up, so that is March the 29th to April the 1st. Hopefully everybody's planning to join, and there will be similar suite to previous years for SDG and the warden. Quite a bit going on right now with ongoing recruitments between a CIO position, economic development officer, and we're starting to ramp up to recruit for our summer students. So there's a little bit of opportunity going on currently with SDG, but those are just a few of the items that I wanted to highlight for now.
Thank you. Can we expect an agenda? When's the agenda coming out for the committee of the whole?
Thank you. Very good question. We're going to have that agenda ready today or tomorrow. So the meeting will primarily comprise of an opportunity for a couple of the associations to come in to speak. At the beginning of the meeting, we're going to have a presentation by Cameron Harper and also Phil Duncan to go through some of the things that have come to council in the past about tree planting along county roads. So we're going to do a fulsome presentation, allow an opportunity for other groups to come in and provide their feedback, and then there's an opportunity for council to engage in dialogue. So that's for the most part the plan for the meeting for a week from today.
Perfect, thank you. Moving on to motion and notices of motion. I'll ask Councillor McDonald to.
Yes, sir. First, I just wanted to remark that until Cameron and I took over the seats yesterday for that disaster, we cleared it up in 3 hours. So next time, I think we should be the first ones called in. So just on notice of motion, I'm sorry I didn't bring this up at the beginning. North Glengarry has an issue with the road, County Road 43 at 20 and Angel Road. We've had several motor vehicle accidents in the last year and a half. It seems to coincide with when the car dealership opened up, and it seems like they're back far enough, but we've had many near misses. We had one of our ambulances that a car came directly through County Road 20 and demolished it. We got a response back from the counties, and I would like a more fulsome report on it. I think it's very dangerous there. I don't know why, and it's the same thing at the Apple Hill one as well. It's a small turning lane, and people seem to think when that's in the turning lane, they pull out, and a car goes around, and that seems to be what we're seeing. but we'd just like to maybe see some action on it. Similar to the Chesterville, it seems like there's lots of room to see both ways, but we just seem to be seeing lots of accidents.
Thank you. Do you want to comment?
Yeah, I would,
Councillor
if you
Broad?
mind. Ironically enough, I wrote it down. I would like to get the OPP updates through the roads department on 43 and 7, as you just mentioned, as well as 31 and 18. So maybe it could be, and the Apple Hill, and maybe it could be a little bigger presentation on some of our higher intersections that we've been dealing with over this term for sure. So thank you.
So, Madam Clerk?
Yeah, through you, Mr. Warden, I can form a simple motion to direct staff to report back on various intersections information at a future meeting, if that works with you. Would read that council be directed, that transportation services staff be directed to report back at a future meeting on various information on various intersections. Specifically, I can name them. County Road 43 and 7 and 20. County Road 31, intersecting 18, and County Road 43 and 7. That's it?
Yeah.
Okay.
Yep. So those three.
Maybe
Go
another-
ahead, Councillor Densham.
May I add to the list the end of Avamore Road down by the river? So right down at the end of 15. 2 and 2. Thank you.
Oh, 15 and Highway 2, down at that south end. Okay. So moved by Councillor Densham, seconded by Councillor Broad. Thank you. So you've got your directives there, Cameron? You're good for that? Perfect. Thank you. So moving on to item 13.1.
We didn't vote.
Oh, sorry. All in favor. Motion is carried. Moving item 13.1 in regards to the petition from William Peace in Long Sault Roundabout. I believe it's Cameron that's going to speak on that.
I can certainly, through you, Warden, I can certainly speak to it a little bit. It's more so for council's information if you have any questions on the petition as it is or how it's come in. Essentially, the gentleman is unhappy with the county's response to do nothing. It does meet current minimum maintenance standards, is not requiring repair. We have upwards of 1,000 plus of these catch basins throughout the county. Our main concern about going in, cutting asphalt, trying to lift that catch basin a little bit is that an asphalt patch is not as strong as the hot mix laid down as part of that contract 5 years ago. And so our fear is that opening that up is just going to make that situation worse at the particular site. So it's not ideal. It is about 60 centimeters. Minimum maintenance is 80 centimeters. 6 centimeters and 8 centimeters. So it's not ideal, and yes, it is settled a little bit, but from our perspective, opening that up and either moving it or adjusting it is going to cause more harm than good, just because of how good the condition of the asphalt is around the rest of that catch basin. So open to any questions if council has them.
Any comments or questions? Go ahead, Councillor McGillis.
Thank you, Mr. Warden. Is there any possibility of increasing it's a concrete. I worked on many storm drains over the years, and could you put another level of concrete on top of the existing one to make it higher and then put the asphalt across? That way the asphalt's not taking on the weight as much. Is there any possibility of doing that, please?
Yes, there's something known as a concrete riser that you would typically add to increase the height of these catch basin lids. You still need to cut a square of asphalt around the catch basin itself to make that work happen. And that's where it's our opinion that we would end up with more problems and settlement and having to maintain that that asphalt patch around the catch basin than leaving it as it is currently. So.
Go ahead.
Okay, thank you very much. Just if council decides they deem it not necessary to do anything, just keep an eye on it so it doesn't sink any further, because it's getting bad. I mean, I saw it the other day, for things like motorcycles, bicycles, maybe pedestrians. So just a word of advice, and maybe to keep an eye on it over a length of time to see if it lowers any more. Okay?
So it does meet the minimum standard. Is there any other comments or direction from council for public road? Go ahead, Councillor Lang.
Thank you, and through you, Warden. Just if we were to put a riser in there, I don't know if they come in 2 inches or not, how much do you have to cut? Because I'm just looking at the picture, it looks like there's already a substantial crack at about, 2 or 3 inches, maybe 4 inches, or is it a bigger area that you have to cut? Is that the issue? I'm just curious on that.
Not an exact size. You can keep the excavation rather tight, but you still do have to cut, at least a foot around the outside to get your compaction back in for your materials that are being replaced, right? So, and of course it is a storm drain, so you're not going to raise it flush because it does have to be lower to collect water, so.
Any other questions? Can I get a show of, or a nod just to the direction? Do we leave it right now in the hands of Public Works and leave it status quo? It does meet the minimum standards, but to keep an eye on it. Is Public Works okay with that? Thank you. Moving on, I guess we have a closed session, so I would like Madam Clerk to read the motion, please.
It's moved by Councillor Broad, seconded by Councillor Densham, that Council proceed in camera pursuant to Section 239(2)B of the Municipal Act 2001, personal matters about an identifiable individual, including municipal or local board employees, for a human resources matter.
Thank you. I'll just give her, so we'll take, all in favor? All in favor, sorry. Motion is carried. Clerk?
It's moved by Councillor Lang, seconded by Councillor Densham, that council rise and reconvene in open session without reporting.
Moved by Councillor McDonald, second.
Yep.
Oh, you have the mover? Sorry. Okay. All in favor? Motion's carried.
And then through you, Mr. Warden, there's one more motion that will require a mover and a seconder, and it reads that the following council members be appointed to serve on the CAO Selection Committee: Warden Francois Landry, Councillor Martin Lang, and Councillor Jason Broad.
Thank you. All in favor? Oh, so moved by Councillor Williams, seconded by Councillor Fraser. Any further questions? Seeing none, all in favor? Motion is carried.
And then ratification.
Yeah, I don't know where my page went, but go ahead
All
with
good.
ratification.
It's moved by Councillor Densham, seconded by Councillor Lang, that bylaw number 5522, being a bylaw to adopt, confirm, and ratify matters dealt with by resolution, be read and passed in open council, signed and sealed.
Thank you. All in favor? Motion is carried, and our adjournment.
It's moved by Councillor Bergeron, seconded by Councillor Broad, that council adjourn to the call of the chair.
All in favor? Motion is carried. Thank you very much.